Millions of women across the US could lose their legal right to abortion.
This could be the most consequential opinion in decades.
From the Supreme Court that would overturn Roe versus Wade.
Raises questions about the future of Roe versus Wade and what this means for abortion rights in our country.
So this is happening in the US right now, and lately I've been wondering, why the f is there not a birth control pill for men?
What's up guys, Derek, moreplates.com. Today we're going to be reacting to Without Roe vs. Wade, We Need a Male Birth Control Pill, the video by Johnny Harris, a very thoroughly researched and high production value video where he describes the history of birth control and its inception, how women have been essentially forced to be the ones to take the brunt of the responsibility kind of unfairly, and the effects it has on them, and men need to take responsibility and kind of push for the further development and research of novel compounds that could then allow them to do their own birth control, because the burden of responsibility, according to Johnny, should be on both parties, not just the females, which is an understandable and logical conclusion to come to. And he has a lot of really interesting breakdowns of, again, like some of the history and whatnot, some of the legal implications and whatnot, but mainly I want to get into the actual pharmacology, because he mentions the side effect profile of birth control in women specifically. And by the way, go watch his full video. I'll link to it in the video description below. Editor, please put a link in the video description to the full video. Apparently YouTube has age restricted it based on community guidelines, which is unfortunate, because this is like clearly a fully educational video and was very, very thoroughly researched. But anyways, getting into the side effect profile, a lot of people just skim over it, and it's like, it almost seems like it's left up to chance. Like, are you one of the individuals who's gonna have a side effect? And some people get it, some people don't. We don't know why. It just happens. There's like signaling stuff, he breaks it down in very, very layman's terms, so Gen Pop can kind of wrap their head around the information. But this is going to be like a lot more scientific and a lot more literal about what's happening at the hormonal level. So we get into the side effects portion specifically I want to get into first, and this is on the female side.
It turns out that changing the hormones that make it so that this doesn't happen also has some side effects, because hormones are not isolated to one system. They don't just affect this. You mess with hormones, you mess with all the systems. It's an interconnected thing that changing the level of one can affect many others.
Absolutely. So even minor changes in hormones can have massive impacts on stress resilience, emotional stability, leading to depression in some cases. Like, some people are become like very, very unexplainably moody, irritable, etc. and this is just like from a mood kind of perception aspect too. I'm not even talking about like physiologic, the manifestation of side effects from hormones impacts. Like, there are so many things from even like a disease development aspect too, cardiovascular disease, neurodegeneration, this, that, like how many things are impacted by hormones. It's like your entire systemic infrastructure, from a mood aspect all the way down to a signaling aspect in several organ systems to actually perform physiologic functions and keep you healthy and just living like a high vitality individual. If hormones are out of whack, out of balance, even if they're in sufficient quantities, if they're out of balance even, the manifestations of side effects are very, very expected.
But listen, who am I to talk about this? I've never taken this pill. I've never been on any sort of hormone treatment. So let's talk to people who actually have.
I had never had a panic attack before. I rarely had anxiety. When I started taking birth control, literally everything made me anxious.
I had very oppressive and debilitating depression to the extent I've never felt before. I would look in the mirror and wouldn't recognize myself. My brain felt like mush.
I didn't realize how much it's changing me, how much it affects me, until I stopped taking it. So I only felt real me once I stopped taking the birth control.
Definitely the worst part was the emotional toll. I felt like a different person. I was constantly upset. I got angry. I was crying.
Because of the pill, I developed this giant blood clot inside of my uterus and I had to get it removed.
Hormonal birth control was in some ways really awesome, but at the same time, I didn't have a sex drive. And I started birth control before I started having sex. So I really thought that there was something wrong with me.
It was a very dark time in my life, and when I went to the doctor, I asked if the birth control pill could contribute to that, and I was basically laughed at.
It is so frustrating to deal with side effects that mess with your mood and with your feelings, because it's so easy to just internalize that and to gaslight yourself into thinking that this is just the way you are now. I guess I'm just moody. I guess I'm just grumpy all the time. And it's hard to take a step back and to think, am I going through a hard time? Or are these side effects from my birth control pill?
It was like a roller coaster for 2 years. What you don't know is like when you go off, your hormones are crazy. Like you shed hair like crazy. Like I was pulling out clumps of hair. I was like, is something wrong with me? And then you Google it and you're like, oh no, that's normal. That'll last for like 6 months to a year.
I mean, this is a very widespread, well-known, well-documented thing.
Yeah, so you don't have to look very far to find females who've been affected in some capacity by birth control, oftentimes combined oral contraceptives. So, a lot of the things mentioned are worth touching on, like the shedding of hair, telogen effluvium induced by a hormone fluctuation, or a deprivation of adequate amounts of, fill in the blank. Are you using just a progestin-based compound that is going to be suppressive of your androgens and subsequent to that estrogen as well? Or you want to combine oral contraceptive and it's shutting down your total T as well as your free T so significantly that you end up being essentially, I don't know, like hyposexual or whatever, like asexual, like to the point where you literally have no sex drive. This is very common among women as well. Among some of the other things like the emotional instability, the depression. And the problem is the age at which women get put on these combined oral contraceptives is so young, they haven't even gone through puberty fully yet. So they don't even really know what to expect otherwise. So they think this baseline of them on these synthetic progestins and estrogens, or just progestin or whatever it is that you're using, that is your normal. And then if something is wrong in your life, it's just a result of something that you are, like reacting irrationally to, or you just can't wrap your head around like why something is happening, or it's just, you just assume it's normal. Like to think that, to even conclude that you might be asexual because of your birth control pill would be, most women have no fucking clue at the end of the day. Like you would not think this is even an issue, because when you ask your doctor a lot of the time, a family physician who's been with your family for years, or whoever it is that prescribed it to you, they are not very well versed when it comes to hormones, unfortunately. This is something that is very, very problematic because you have a lot, I'm not saying all doctors, by the way, it's just unfortunate how little of an emphasis is put on this part of the education process around hormone exposure, when it's like given to so many young girls and they aren't properly educated about its side effect profile. It'll be like, oh, you might get, some mood swings, you might, have some hair fall out, you might have a little bit of depression, maybe your sex drive changes a little bit, but people don't really highlight the actual, like at a practical level, like what happens to your blood work, what happens to your biomarkers, what happens to your hormonal signaling from a natural perspective. What are these hormones even doing that get put into you? Like, what is a fucking synthetic progestogen? What is a synthetic estrogen that agonizes the receptor with multiple times the magnitude of potency, like ethinyl estradiol versus your bioidentical estradiol that you produce naturally if you weren't like essentially pseudo castrating yourself with a pill? These are things that you should understand before you're exposing yourself to them. It's not so much different than, like a guy going on like anabolic steroids, for example. This is a wild example to try and wrap your head around, but at the end of the day, a lot of these progestins that are being used in oral birth control are derived from testosterone or 19-ortestosterone. This is called nandrolone. It's a compound used by bodybuilders and is very suppressive to the point that like progestins, not only do they have negative feedback through their agonism of androgen receptors, but in addition to that, their progestogenic activity very heavily suppressive to a point where you can get away with micro quantities of it and keep yourself shut down and or prevent, for women, and for example, at micro amounts you can prevent conception from occurring. So this is where the utility of them comes in, and where it becomes very, very difficult to even say that a male should take the responsibility too, because for a male, in order to achieve azoospermia, which is like if you have no viable sperm for actually achieving conception at all, the degree of suppressive activity that you need in a male to achieve that outcome is magnitudes higher than it is for a female to achieve a hormonal state that is conducive to just not allowing fertilization. So for a woman, you don't have to literally shut down their androgen status to fucking zero. Whereas for a dude, now again, this is hopefully where, developments in pharmacology and, potential workarounds come into play. But ultimately for men, there's essentially condoms and vasectomy are like the only surefire things. And then when you go the hormonal route, if you actually want to achieve azoospermia, like there is so much production of sperm relative to eggs in women, like you need to be going nuclear in men to actually achieve this outcome, to a point where even if a man was to take on the responsibility and be the one doing the birth control hormonally, I'm not saying this justifies it, by the way, I'm just trying to explain like what would happen. Let's just say you give a guy a shit ton of levonorgestrel and testosterone. What is the outcome of that? Or if you just give him levonorgestrel, and we're going to get into concurrent use of testosterone later, but levonorgestrel, like a heavily suppressive progestin that women are using in birth control right now, it's a very, very common progestin. Is this something that can achieve like full suppression in men? Yeah, even on its own, it's actually very, very difficult to achieve complete like sterilization essentially. And to a point where to actually achieve this azoospermic outcome, you would need to basically castrate the male as well as have like a progestin on top. Based on the literature that I've seen, at least in practical application in like bodybuilders and whatnot, to a point where you would essentially be like a floppy dick disaster where you couldn't even have sex to even enjoy the fact that you're controlling your birth control to begin with. Like the whole point is to be able to have sex and enjoy it without having to worry about having a kid when you were not intending to. However, if the way to get there was essentially shutting down gonadotropins to zero through intense negative feedback with androgen receptor activation, progesterone receptor activation, using anti-androgens or progestogenic compounds like in female birth control at much higher dosages, are you actually going to be, even if you achieve birth control, are you even going to be a functional male? Like no, the disparity between female achieving this, infertility versus a male, like your disparity of getting down to azoospermia is like magnitudes higher to where your quality of life is likely going to be so shitty that a female won't even want to be with you to begin with. Now, I'm not saying that justifies it. I think you probably won't even have sex. Your dick will be non-functional. You'll have no sex drive, nothing. Now with women, there is definitely a disparity between natural women who are not on anything, who are functioning fine, and some respond worse to birth control and some respond to a point where they barely notice the difference. Now, fortunately, at least for them, they can achieve this infertility with a proportionally lower dose of a synthetic progestin, and they can concurrently use exogenous estradiol and not have to worry about the disproportional impact on androgenic activity relative to estrogenic activity as much as men do, because you do not need as much actual burden to achieve this infertility outcome where you would be otherwise suppressing their testosterone into like abysmal, non-functional territory where you literally don't even want to have sex. But it's still dramatic, and that is the point of this whole thing, is to outline the side effect profile. All those women, all of their experiences, very, very common, and the dramatic impact on hormones and the lack of education around it is absolutely terrifying. So if you look here, we have a study, the effect of combined oral contraception on testosterone levels in healthy women, a systematic review and meta-analysis. So in here, we looked at combined oral contraceptives reduce the level of androgen, especially testosterone, by inhibiting ovarian and adrenal androgen synthesis and by increasing sex hormone binding globulin. Something very, very notable. It's not just about suppressing androgens or just to achieve this outcome, but SHBG skyrockets. Although this suppressive effect has been investigated by numerous studies over many years, to our knowledge, no systematic review concerning this issue had been performed. This systematic review and meta-analysis was performed to evaluate the effect of combined oral contraceptives. And keep in mind, we're talking about combined oral contraceptives, not all birth control here, like copper IUD, a non-hormonal way to go about achieving infertility. And it will vary, your risk profile in terms of side effects. And the side effects even in question are going to be different too, like using like a physical instrument versus a like orally bioavailable pill of hormones, like obviously different outcomes. But ultimately, like which one is going to be superior from a hormonal aspect, like obviously something that doesn't involve loading yourself with progestins and shit in order to like essentially castrate yourself. So anyways, no meta-analysis or systematic review has been performed yet to our knowledge. So basically they wanted to evaluate the effect on combined oral contraceptives on concentrations of total testosterone, free testosterone, and SHBG in healthy women to evaluate differences between the various types of combined oral contraceptives. For example, estrogen dose, type of progestin, and the assays used to assess total and free testosterone. So basically combined oral contraceptives, the likelihood is high if you're on a birth control pill that you are on one of these. So you have like, Ales, Lolo. There are tons of different ones. What are some of the ones I had brought up on the screen here 2 seconds ago? We have Yasmin, like there are a shit ton of different ones. And at the end of the day, most of them have overlapping mechanism of action, but slightly different drug based on the pharmaceutical company that brought it to market, and different effects on hormones to a different magnitude depending on the compound. So again, and it's not all the same. Like if you're on Yasmin versus Ales versus, like it's not all the same. These have different drugs in them, although they oftentimes leverage ethinyl estradiol as the base estrogen to be using. So anyways, these are heavily suppressive and are used for a reason and achieve a infertility outcome that is not going to be as, it's not going to be as side effect ridden as using like shutting a male down from a total testosterone of 700 down to like castration levels. The impact of a female going from like 60 nanograms per deciliter in testosterone down to like 40 or 30, the magnitude and quality of life difference might not be as bad as a guy going from like 600 down to like female levels to achieve azoospermia, which is likely going to be the outcome. However, there is definitely ambiguity between these two scenarios. I'm not saying one is better than the other or whatever. I'm just saying like the dramatic difference that could be implicated in a male trying to achieve the same outcome with the same approach of hormonal contraception. So anyways, getting into it, a review of the literature was performed using database searches, etc., etc. We get down to the results. A total of 151 records were identified by systematic review in 42 studies with a total of 1,495 healthy young women aged 18 to 40 were included in the meta-analysis. All included studies were experimental studies and 21 were non-comparative. Pooling of the results derived from all the included papers showed that total T levels significantly decreased during combined oral contraceptive use. Significantly lower levels of free testosterone were also found with a mean decrease of 61%. 61%. On the contrary, SHBG concentration significantly increased during all types of combined oral contraceptive use. Subgroup analyses revealed that combined oral contraceptives containing 20 to 25 micrograms of ethinyl estradiol had similar effects on total and free T compared with combined oral contraceptives with 30 to 35 micrograms of ethinyl estradiol. In addition, suppressive effects on testosterone levels were not different when comparing different types of progestins. Basically, the conclusion is that combined oral contraceptives decrease circulating levels of total T and free T and increase SHBG. Due to the SHBG increases too, free T levels decrease twice as much as total testosterone. So this is dramatic. Like the effect on, again, total testosterone levels in women, not that high at the end of the day. 50 nanograms per deciliter and like a high tier, like a high producing female is normal. Now, with free testosterone levels, because SHBG levels, this is a binding protein that essentially regulates androgenicity in the body and kind of dictates when androgens like testosterone get delivered to target tissues in the body and get used, for whatever purpose it is to maintain physiologic functions. And this includes like sex drive, psychoactive activity, muscle growth, etc. So in these women using combined oral contraceptives, the free testosterone, the freely circulating androgen that they rely on for driving libido often, to a large degree. Obviously estrogen very crucial in that too, but this is like the differentiating factor between like male and female is testosterone, and females still require it in order to build muscle, actually tolerate glucose as well, and be like insulin sensitive, among numerous things in addition to just like emotional stability, stress resilience, etc. And decreasing that free level by over 60% is dramatic when they already don't have like that much to fucking begin with. This was another study. This was bad. And the reason I even came across this literature years ago was I started to get very interested in it when a girl I was dating actually had a very, very low sex drive, like way worse than anybody I had been with before. And I was like, damn, like, what is the reason? And I started to dig into the hormonal systems and the impact of the birth control she was using specifically, and found some pretty interesting findings when I was trying to understand this stuff. And this study in particular, I was very, very interested in because it showed a way to backfill testosterone levels that were being suppressed whilst still staying on the combined oral contraceptives using DHEA. But the thing I want to outline in this specifically is the impact of these two different combined oral contraceptives. One is utilizing ethinyl estradiol and levonorgestrel. This is the components of ALES. So ALES is combining levonorgestrel and ethinyl estradiol. I'm assuming there are other birth control brands out there that utilize this combination of progestin and estradiol, synthetic estradiol. And in addition to that, droseparinone and ethinyl estradiol combo. So this is the combination used in Yasmin and as well presumably in other brands as well. But these are very common things that a shit ton of chicks are using. And in this, what we found was that both combined oral contraceptives decreased the levels of all androgens measured. Now, to a different magnitude, but still problematic in their own different ways, and I'll explain why. Significant decreases were found with ethinyl estradiol and levonorgestrel, so with ALES or other comparable combined oral contraceptives using this combo, and ethinyl estradiol, and this progestin used in Yasmin, as well as other comparative ones. For total testosterone, 54%, 54.5 and 11.3. So ALES and comparables, over 50% drop in total testosterone. Dramatic. Now, the Yasmin one dropped only 11.3%, which doesn't seem as bad. However, free testosterone level drops was worse in the Yasmin one than in the ALES one. Reason being is the effect on sex hormone binding globulin is more significant in the Yasmin one. So again, despite the fact that total testosterone levels are decreasing precipitously more with the ALES one, you have a greater drop in free testosterone because of SHBG skyrocketing. So at the end of the day, these things are both like nuclear fucking disasters on your hormone production. And are you going to rely entirely on this progestin to supply your sex drive and your androgenic activity as a female? No, it's not that androgenic. It's not going to be that useful from an androgenicity standpoint to actually replace what you are depriving yourself of testosterone wise. So the effect of like girls becoming asexual on this stuff, not surprising when you see the impact it actually has on hormone levels at the end of the day. Like a 75.6% drop. Like you are taking yourself down to like toddler territory of fucking free test levels, presumably. So again, it's something that is shocking that people are just put on this at like, like mid-teens or early teens. Like, oh, if you're gonna be sexually active, here's a pill. Just take one a day and you'll be good. And it's like, yeah, you've achieved infertility through pseudo-castration, but what are the byproduct, what's the collateral damage of that? Is that adequately elucidated? When you were prescribed combined oral contraceptives, were you made aware that your free testosterone could drop by 75.6% and you become asexual, and then your asexual nature is a result of this pill? Like, was that like clearly elucidated, as well as all the other things that, some of these women have mentioned that they experienced as very, very potential, side effects? I feel like most people did not have that outlined adequately. And I think that is a failure in the current medical system to be putting people on such aggressive therapies without adequately educating them first. Like, it's one thing to say like, here's, this is the birth control option that we would recommend, but be aware that these side effects could very well happen. Like, this is the effect it has and why. And I get that maybe in like a quick appointment with like a family physician, they don't necessarily have the time to go over that. Unfortunately, there are people, by the way, I'm not like shitting on the entire like system. I'm saying that in general, I feel like more education needs to be provided around this stuff because it's a serious intervention. It's not just like, oh, take this and, you'll be fine, enjoy your sex. Like, even enjoying sex can be way more problematic, if not impossible, as a result of this stuff. And in males, it's going to be even more dramatic, which we'll get into in a sec with the combined administration of levonorgestrel and testosterone on men. So this is a study assessing the same birth control modality for progestin on females and men. Because again, if we're going to revisit this whole, let's go back to the video and hear what he has to say before we continue.
A study from Denmark found that women who take the pill that has hormones in it are more likely to suffer depression compared to women who don't. And again, this isn't just like once a month. This isn't just like every once in a while. This is every single day you are putting this hormone modifying thing into your body. And is it surprising that some women have really serious effects with this? I mean, the pill is tampering with arguably the most biologically important system we have. Okay, but really quick, before you like demonize the pill is amazing and it's totally safe. 150 million women take it every day. And for a lot of women, it actually helps regulate some of their hormones that are off balance. So if you have questions about birth control and hormones, don't listen to a random dude on YouTube. Go talk to a healthcare professional. Thank you.
Well said. As a random guy on YouTube talks to you about this. Again, I'm not saying I'm the fucking end all be all of this stuff. I just have seen the impact it's had on multiple women in my life at this point, and I've thoroughly educated myself in order to understand the impact it can have in both a negative aspect as well as the actual desired outcome aspect. And it's definitely worthwhile to educate yourself too if you're going to be subjecting yourself to any sort of hormonal therapy. Because again, this is very impactful on your quality of life from multiple different aspects. Before you just like put something in your body, it's definitely worth asking questions and digging into some of the literature yourself, because again, some doctors will be open to discussing some of these side effects with you and giving you the real scoop if they are fully aware of it. It's just oftentimes they aren't aware of it and they will not give you an adequate answer, in my opinion. Like again, like this, one of the girls said she got like laughed at by her doctor for suggesting that it could be related to the pill or something. Like that is not an uncommon outcome, unfortunately. And this is why I think not just trusting the one doctor you've talked to and actually educating yourself from multiple like credentialed resources too. Like these are like published papers and like meta-analyses on people who are studying this specific thing for their fucking living, as opposed to a doctor who is expected to know like a little bit of a shit ton of stuff. It's a bit different, and I think educating yourself is absolutely worthwhile. Now, getting into the male part of this video, he discusses vasectomy and condoms, and then kind of discusses like what our options are as men, and we'll get into the rest of it in a sec.
CDC data. But now we've got other options too. Like there's this little T that women can put in their uterus for up to 10 years. And it can either release hormones to kind of do the same thing, or it can be wrapped in copper, which kills sperm. No hormones at all. It's 99% effective and the second most popular form of birth control. And the third most popular is a condom, which of course doesn't release any hormones and does not get ingested into our bodies. And it is kind of our one birth control method that we have as men, in addition to a vasectomy. Like those are our choices, that's what we've got. And that is my question. That is the heart of why I made this video, which is like, why is all of the tampering with the hormones to prevent babies thing a female thing? Why didn't this history happen to men? Why don't we have a pill that sends overwriting emails to our balls or something? Well, of course, there's the obvious, unquantifiable reality that the people holding the power and the money and wearing the lab coats have always been men who get to decide what to research and what to focus on. Oh, and that controlling women's bodies has somehow always been normalized and still is. Exhibit A.
The draft Supreme Court opinion showing a majority would overturn Roe versus Wade.
Overturn the landmark Roe v. Wade case.
Oh, and of course, we live in a society where women are responsible for all things babies. After all, it grows in their uterus. So it's not that surprising to me that the scientists weren't out there recruiting Puerto Rican men to participate in some unethical study about controlling their bodies and what they can and can't do. It's laughable to think about that scenario because it just would never happen. But it would be slightly a cop-out if I just left the explanation at structural sexism, which is absolutely a thing, it is real. But there are some other explanations for why we don't have a male birth control pill. Let me break those down for you, and then let me show you what options we dudes do have, which is kind of cool. Like there's some really cool emerging stuff, so let's look into it.
But I was wondering why there's so many sperm cells and only one egg cell.
Here, maybe a diagram.
In progress. One of the most promising studies we found in our reporting was not a birth control pill, but a hormonal gel.
This is not a pill, it's actually a gel that's applied daily to a man's arm or shoulder.
And local researchers think this could be it.
In men who've used it as directed, there have been no little surprises.
The hormones tell your body to stop producing sperm, and it works really well in trials.
So I'm under the impression, I'm assuming, by the way, like I couldn't read what was on the bottle, but it doesn't tell your testicles to not make sperm. Rather, you are shutting down your HPTA to then prevent the signal from getting sent to your testes, consequently resulting in a lack of Leydig cell stimulation and no intratesticular testosterone production, as well as Sertoli cell stimulation through follicle stimulating hormone. So I'm assuming this is going to be like some fucking like transdermal progestogen or something. Like again, like there's been studies on Testosterone, a compound used in bodybuilders, but like the actual research is based on it as a birth control modality. Reason being is it is something that is very, very potent progesterone receptor agonist, but also has androgenic activity that may otherwise backfill what happens when you shut down your test levels. And that is the large discrepancy in kind of like issue when it comes to contraception in men, is achieving this lack of like complete wiping out of Leydig cell, Sertoli cell stimulation in the testes, like trying to achieve that outcome and achieve like true azoospermia is something that is going to rely on like essentially nuking your HPTA, having like such significant negative feedback that you have no gonadotropin output, or like castrating yourself significantly with like a fucking GnRH agonist, like something they would use in like I don't know, like pedophiles and stuff, you know? Like these are the kind of treatments that are being evaluated for men, to a point where you are probably, and I'm not even saying GnRH agonists are going to fully achieve that. It seems like they may have their shortcomings too. So imagine like fully castrating yourself and still not even achieving the outcome you're looking for. Like you're not gonna wanna have sex if you are literally that, like the hormone levels of a, you know, like prepubescent like child essentially. So interestingly enough, at the start of the video, they mentioned how this guy did a poll and 80% of men said they would be willing to use hormonal birth control.
Polled all of you, 80% of men are saying that they would be up for taking a birth control pill. So let's talk.
See, I'm like surprised at that ratio. Like put in the comments down below if you would be willing to take a birth control pill, all men watching, which presumably is a large majority. I think I have like, I don't know, 5% female audience or something. Maybe more will be on this video though, because of the nature of the video. But down below, guys, comment, would you take a birth control pill? Even knowing what it takes, I guess maybe your answer will change after you see the rest of this data, unfortunately. But there are potential promising developments, but that remains to be elucidated. But let's hear what he says about the options later in the video.
But it's still pretty early. And lastly, there are of course pills that are being tested. There are a lot of different approaches to these pills. Some of them are hormonal, like the birth control pill that was racistly developed in Puerto Rico, sending new emails to sex organs to get them to not do the thing they're used to doing. But some of these pills don't use hormones at all, but rather a Chinese herb that changes the shape of the sperm's head to make it a worse swimmer so that it can't reach the egg. It's so funny to me to think of like, we got too good at like procreating and now we want to stop it. But evolution's like, dude, we've been trying so hard to make this easier. Stop changing the sperm's head to look like a hook. There's another pill that cuts off the special protein found in the testes that then stops the sperm production. It's like all these clever ways of like reprogramming the body. It's been 99% effective at preventing pregnancies in mice. And the moment they stop taking it, they bounce right back to normal fertility. Very promising on mice. Clinical trials on humans are supposedly gonna start this year, like progress. But do you notice, it's 2022. We've invented all of this amazing stuff and we're still in early trials of all of these inventions.
So overarchingly, you know, he wants there to be a responsibility taken by men as well. And further, like he's hoping for further developments. Like obviously his audience is very, very much in favor of they'd be willing to take a pill as well. And I believe the compound he was referring to at the end is probably this, a lot of people asked me to make a video on it at the time. It was a, let's see, I think like a retinoic receptor agonist or something. Retinoic acid receptor alpha. This protein is one of a family of 3 nuclear receptors that bind retinoic acid, a form of vitamin A that plays important roles in cell growth, differentiation, and embryonic development. Knocking out RAR alpha gene in male mice make them sterile without any obvious side effects. Other scientists have developed an oral compound that inhibits all 3 members of the RAR family, alpha, beta, and gamma, and causes reversible sterility in male mice. But George's team and the reproductive biology collaborators wanted to find a drug that was specific to RAR alpha and therefore less likely to cause side effects. So this achieved 99% efficacy in male mice for 4 weeks. And they were able to father pups again 4 to 6 weeks after they stopped receiving it. So obviously promising, but has yet to play out in humans. Now, at the end of the day, you know, what options have we seen in men? So this is the principle of hormonal male contraception is based on suppression of gonadotropin. So these are the signals to your testes to actually produce sperm and intratesticular testosterone. So suppression of LH and FSH, depletion of intratesticular testosterone and atrophy of spermatogenesis, and substitution of peripheral testosterone to maintain androgenicity. So the main downside that we see is that individuals who end up using these, like if you use a birth control modality like a woman does, like a levonorgestrel plus an estradiol or ethinyl estradiol, you would end up with like breast tissue development being very, very non-masculine. You would shut down, like basically you're almost like transitioning essentially at that point, and you will not want to. The likelihood of even having like your sex drive intact is very, very low. And all of this to achieve azoospermia at what dose too? Like the dosage would be much different, and the compound selection, like you're probably gonna have to, like the main thing I've seen that even resembles this same outcome as a girl on birth control would be a guy on like nandrolone plus testosterone, like that, or ment plus testosterone as a base. And that is like a synthetic anabolic androgenic steroid that is a very, very potent progestin that is derived from testosterone and provides enough androgenic activity to support some physiologic functions that testosterone otherwise would. But ultimately, at the end of the day, it seems like in all of the research, if you're gonna shut down yourself and actually achieve like complete suppression of this stuff, you're going to have to essentially end up on TRT concurrently. So you're asking a lot of men, whereas for, again, it's asking a lot of women though too, is the problem. It's a very, very finicky system to manipulate, like significant impacts to quality of life and potential long roads to recovery too, especially for men. Like if you want to achieve azoospermia and then one day you want to have a kid and you tell him like, oh, you've been on like nandrolone for 10 years now, it's time to come off. Not only is he going to have to deal with clearing it out of his system for like upwards of a year before he can achieve like good fertility metrics again. But even at that point, there's no guarantee he actually restores fertility adequately without using a bunch of drugs. And for women, again, they face similar challenges and risks too. However, the degree to which they are likely to have permanent infertility seemingly less problematic than if a guy was to use a trestolone or a nandrolone or a something in order to achieve infertility. However, that is a very, very cursory glance of what I am aware of from the progestin side of things, and is certainly not indicative of if there potentially is more viable compounds. Like it seems like ment, you know, a very, very interesting compound at low dosages. But ultimately, you kind of get the point is at the male level to achieve azoospermia, it's not just having like a localized, you know, progestin releasing like insert that you can get away with as a woman, or to use a copper IUD, or to use just like a, you know, an oral pill necessarily. Like you need to be using like going full nuclear to shut yourself down to a point where you need full suppression of LH and FSH to essentially zero. You need depletion of intratesticular testosterone and atrophy of spermatogenesis. And then at that point, you are essentially a castrated like child, and then you need to use TRT too just to function at a high level whilst concurrently keeping yourself infertile. It's like a very, very tall task. And it's a big, big ask for men, to a point where you were essentially putting them on like a weird like Frankenstein steroid cycle just to achieve infertility. But all of this is not to discount the fucking disaster that is female combined oral contraceptives that I've mentioned earlier. As you can see, I'm not a fan of either outcome. I think that like a copper IUD, if well tolerated in women, is probably like one of the options that I think makes the most sense. Obviously, this is individual dependent, and there are issues along with that come along with that too. And in men, you know, like a vasectomy, a condom, like these are things that, like a vasectomy, like when we're talking about something that's easily reversible, or a condom, like achieving an outcome where you can have sex without a condom and not have to worry about, you know, permanency of infertility. Like I don't know, like the most promising agents seem to be these things that are not modulating the actual like direct endocrine related hormones. Rather they are, and when I say that, I mean more so from like a androgen production standpoint. It's using things that are going to mess with sperm maturation and or even like that motility, morphology, like presumably if you're like modulating it to the point where it can't even like fertilized correctly because of this weird fucking hook thing on the end. Like, if there's no side effects associated with that, that seems to be more promising than using a synthetic progestin and shutting yourself down essentially to that of a castrated human. So it's unfortunate that the outcome is so, I don't know, like any kind of hormonal intervention from a progestin and estrogen standpoint seem to be not ideal, is what I'm trying to elucidate. Like, here we have an example of men using levonorgestrel. So this is like, if you had a guy using the LS pill without the estrogen component, what would happen? So we have studies using high dose testosterone in normal men. And again, even if you use exogenous testosterone, you're not gonna shut yourself down. Like, there's so many guys on steroid cycles using high doses of test that still achieve, accidentally oftentimes, you know, they have a kid. So azoospermia rates of only 50 to 70%. So obviously not like adequate enough to be like, okay, just get on TRT and you'll be good. And this is high dose. Previous studies of testosterone and progestogen combinations have shown comparable rates of azoospermia, but have been uncontrolled or used T in doses less than that associated with maximal suppression of sperm production. So here they use 100 milligrams of testosterone and anthate every week for 6 months, with the same dose of testosterone in conjunction with the levonorgestrel, using 500 micrograms orally per day. So if you want to compare that to, you know, a less, what is the dosage deployed in a less? Okay, I had to pull up the actual drug insert to make sure I got this correct. So each blister contains, if you have a less 21, you just have straight drug. You don't have the week of placebo, or not placebo like sugar pills. A less 28 has 7 white tablets with nothing in them. So each pink tablet contains 100 micrograms of levonorgestrel and 20 micrograms ethinyl estradiol. So we're talking about a dosage in men to achieve this outcome at 5 times the amount. So we have 500 micrograms of levonorgestrel per day, whereas in women, they're using 100 micrograms per day. Now, what about Plan B? A lot of people don't realize the morning after pill that, you know, fucks many people up and they feel like shit when they use it. What is it exactly? It's levonorgestrel again. Guess how much it is though? It is either, I believe, 2 doses of 750 micrograms or 1 mega dose of 1,500 micrograms, 1.5 milligrams. And this is something that I'm sure you've heard the risks of using it, you know, too many times and like fucking yourself up long term. Like, this is a dose that is pretty reasonable to achieve this azoospermia in men in conjunction with something that is already HPTA suppressive using exogenous testosterone. So you can see, like, this is something that it still works. It's just the magnitude of suppression needed is higher in order to achieve azoospermia. And then above and beyond that, you essentially need to be on exogenous testosterone, TRT, just to maintain a high level of quality of life while you're doing it. Now, again, is that, you know, it's kind of interesting how women, there was not really any data on them like backfilling hormones. And that was where I went into that DHEA study where I was looking for, at the time, the girl I was seeing, I was like, oh, can I, you know, give her DHEA? And then it like maintains her sex drive while she's using the combined oral contraceptive. Like, ideally, you would just have a better modality of contraception to begin with. But that outcome, it's interesting how they were able to almost restore testosterone levels in, depending on the birth control used. But it's kind of interesting how in men, they actually care about you maintaining your test levels. But in women, it's like disregarded entirely, like it's not important. But it's so fucking important because it's such a huge dictating factor on quality of life, ability to build muscle, sex drive, etc. A million different things. So it's just, to me, you know, the disparity in the research, similar to what he said in his video, like there's a definite different approach taken to how they are researching this stuff. So like in men, they're kind of acknowledging like, we're not going to achieve this outcome without using TRT concurrently in order to support quality of life. But in women, it's just like, let's just basically pseudo castrate you and just leave you like that. I don't know. Anyways, the combination of testosterone plus levonorgestrel is much more effective in suppressing sperm production than testosterone alone. 67% of the testosterone plus levonorgestrel group and 33% of the testosterone alone group achieved azoospermia by 6 months. And so again, even using this high dose of levonorgestrel and exogenous testosterone, like TRT levels, still not able to have a full, like actual high level of contraception in these individuals. Like, this is not an outcome that is really like if you had a 66% chance, 67% chance of achieving the outcome you'd want, is that a reliable form of birth control? Like, you'd probably say, fuck no, dude. Severe oligospermia or azoospermia developed in 94% of the testosterone plus levonorgestrel. So that's a better ratio, 17 of 18 group compared to 61% of the testosterone alone group. Testosterone plus levonorgestrel also suppress sperm production more rapidly than testosterone alone. And the conclusion is that combination hormonal therapy with testosterone plus a progestogen might offer a reversible male contraceptive approach with a more rapid onset of action and more reliable induction of both azoospermia and severe oligospermia than testosterone alone. So again, like maybe they're not actually assessing, you know, should you use testosterone to maintain quality of life, and more so they're just trying to achieve contraception with the least side effects. So they're using a combination of the bioidentical hormone you'd otherwise produce. But it's just kind of weird how for women, they're like put on like the most synthetic shit possible, the progestogen as well as the synthetic estrogen. And then there's no attention drawn to their testosterone levels that could otherwise be addressed in some capacity to at least attenuate the profile, the side effect profile to some extent. But either way, both modalities are like very, very, very impactful in a negative capacity on hormonal systems, to where you even need to then intervene with something like putting you on TRT just so you can tolerate the drug. Now, that's not to say everyone will be able to, you know, be well tolerated by using just the, you know, actual progestogen. They might be able to get away with it. Maybe a guy could use a literal like female birth control aside from the estrogen component, because they'll, you know, literally develop like tits. I have more issues than that. But like achieving that outcome, you know, would some guys be side effect free? I would say very few, because you need to have some androgenic activity too to maintain masculinity, or else you are going to basically just be like a walking shell of a human from a male perspective. So like you can see where the issue comes in, where the modalities trying to achieve the outcome are all intervening with a system that is very, very heavily regulated by your testosterone levels, your free testosterone levels, your estrogen levels, and the way they interact on neurology, on actual body composition outcomes in terms, and as well as drive, libido, stress resilience, emotional stability, etc. Finding something that's going to intervene like way later in the cascade of events, whereby you're chopping off like the ability of sperm to actually develop properly from a morphology aspect, is probably like the most reasonable option from like intervening at the sperm production level aspect. But the best methods are so crude right now still, and utilizing like basic like bodybuilder style like shutdown modalities, whereby you have like progestins just like nuking the ability of your, you know, pituitary to spit out LH and FSH, and basically making you a pseudo castrate and fucking with your quality of life very, very significantly. And this is in both men and women. And it's just unfortunate the lack of education surrounding this stuff. So not only do we like, even if we need a male birth control pill, like asserted in the title here, very, very careful care needs to be taken to what it is, because you could very well end up, like people are already complaining about like lack of like, you know, masculine men in this world, and like the lowering of testosterone levels. Like imagine if you introduce this kind of shit into the equation, you know, like at that point you are basically creating females just to achieve contraception. Worse than that, potentially. You might end up having a lower test level in your girlfriend in order to achieve contraception. Like that's that's how bad some of this shit looks. So I'm not a fan of the modalities used, but you know, they're effective, certainly, at achieving the outcome desired. It's just the way you get there. I feel like more education needs to be put out around it. And I think non-hormonal ways of achieving the proper outcome are more viable. Although, obviously, there are the limitations too, and a lack of options, especially from the male side. So anyways, let me know what you guys think. Would you take if you knew this was gonna like heavily suppress your testosterone levels, would you take a male birth control pill? If you knew the outcome was you would achieve azoospermia, you're not going to get your girl pregnant, is that a hit you're willing to take? And what do you think about the disparity in the situation, the development of these drugs, the different options available for men versus women? Any and all comments, they help the algorithm, they're much appreciated. Also check out Johnny Harris's full video. I didn't want to use too much of his footage because it is a very, very well put together video, and there's a lot of interesting shit, especially from a history aspect. So please go check out his full video and support it, drop a like on it. And yeah, if you want to support me, you can subscribe, like I said, like, and check out anything I'm associated with in the video description below, my preventative medicine hormone replacement therapy platform. If you are looking for high quality medical oversight from providers and doctors who actually understand this stuff and are looking out for your best interests and actually understand how to interpret endocrinology, pharmacology, biology, biomarkers in your blood work from a testosterone aspect and SHBG aspect. If a lot of this shit I'm saying is like Latin to you and you're like, what the fuck have you been talking about this whole time? That is where getting a high quality doctor in your camp who actually understands this stuff is critical, especially if you are like somebody who is using suppressive drugs, whether it be from a birth control standpoint or an anabolic steroid standpoint or whatever it is. Having a doctor in your camp who understands the implications and risks and knows how to address them accordingly is definitely worthwhile. So you can check that out if you need a high quality doctor, or just to get access to high quality self-service labs if you want to check your bloods yourself. You can check it out as well as anything else I'm associated with. It's all in the video description below. Thank you guys for watching. Talk to you soon.